So the assessment of palpitations is really important because you've got to get the right cause and the right diagnosis to know how to treat it properly. And the first step is always with taking a detailed history, so spending the time to talk to the patient about what brings the palpitations on, exactly how they feel, whether there are any associated symptoms, how long they go on for, and so on and so forth. It's then important to examine the patient to see if there's any clues from the physical examination that might point to the cause, and then tests. And by and large, these are painless, quick, non-invasive tests. So, for example, an ECG, where you have little paper dots on the chest to take a reading of a printout of the heart. An echocardiogram, which is an ultrasound scan of the heart in much the same way as pregnant ladies have. And that's a very important test because if you have a structurally normal heart, the chances of there being a palpitation that is very dangerous become less, although not zero. The next most common test is to have some sort of a monitor. So either you'll wear this, if you have symptoms all the time, you can wear this for a day and press a little button which will tell us when you have your symptoms, or sometimes patients can, for example, have smartphone recorders. There are also little implants in much the same way as female contraceptive implants, but they're injected under the skin, and those will pick up palpitations, and they're very useful if people have them extremely periodically, or if they've been associated with very severe symptoms such as blackouts. It's also sometimes important to have other tests that might help to determine the cause. So occasionally patients will have CT scans or MRIs of the heart.